Hi again, my name is Dr. Marlon Rollins. I am the Chief Clinical Officer at Recovery Dynamics. I have about 20 years in the behavioral health industry. I've worked everything from school settings to emergency rooms to hospitals, and I've run several psychiatric facilities and rehab programs in the state of California. What we're doing here at Recovery Dynamics is brand new and innovative. It brings together all of the new clinical innovation and therapies to really enhance the outcomes we're getting to restore the well-being of those people that choose us. So I'm excited to be here and working with this clinical team and the staff to deliver a new product that I believe is going to change the game in ways that we've never seen before. Recovery Dynamics is the inpatient detox center. We've had a 16-bed, lovely facility where we're able to stabilize people and provide a synergy of services. So that's when we talk about Recovery Dynamics. It's the dynamic integration of all the services to help restore the brain and the well-being of the individuals that we're going to be serving in this clinical environment. Well, at Recovery Dynamics, we're providing a holistic experience, top to bottom service for the individual. The first thing that we need to understand is that we're focused on treating the brain and what does the brain need and what does the individual need. So mind, body, spirit, and community. It's not just evidence-based, it's also science-based. We are integrating evidence-based therapies like DBT, CBT, EMDR into one clinical environment in a group setting, plus bring innovative technologies and medicine to help restore the individuals in a dynamic way. So we get the best results by putting all the services together in a systematic way that make the most sense for the individual to get the better outcome in the shortest amount of time. We're integrating a lot of different modalities that are evidence-based and science-based. The evidence-based things like DBT, CBT, EMDR, in combination with innovative technologies like TMS and EMBP, which really help the brain reset itself and allows the effectiveness of the evidence-based treatments to be more meaningful. The learning is improved, the memory is improved, focus is improved. So that's what's different about making a dynamic experience in this recovery center like you've never seen before. The detox phase of treatment is really focused on your stabilization. That means we're going to be focused on cleansing your system and making you safe and comfortable with medication and staff to make sure that you're doing okay. Do you have the proper nutrition? Are you getting the sleep that you need? Are you able to talk to the doctor and make the medication adjustments that you need to get you through the most difficult part of restarting your life? So the individual therapy and the group therapy, they work in concert. So you'll be assigned an individual therapist. That's your go-to person to make you feel safe and to develop rapport with. Develop your treatment plan that's specific to your needs. And then you have an opportunity to go into the group community setting. That's an opportunity to just remind yourself, hey, you are not alone and you have other people who are going through similar things. So it's an opportunity to learn and you can bring back those experiences to your individual therapist and process deeper, and just as much as taking those individual experiences and bring them into the group setting. So that way you have more confidence and a place to process things more safely. So what is dual diagnosis? Now, we're talking about a mental health diagnosis versus a substance use disorder. The truth is, it's not one or the other, it's both. And at Recovery Dynamics, we're treating you both as the individual. We want to stabilize both, get you off of the substances that are creating chaos in your life and making you feel uncomfortable and making you feel better about regulating your nervous system, whether it's anxiety, depression, or bipolar disorder. We're here to treat both at the same time and make you the person that you want to be, to come forward and not be taken over by these diagnoses that you've been labeled with. We want you to redefine yourself, redefine your life, and redefine your purpose. And that's what our goal is. You can come here and know that you're not alone, because these things are overwhelming and they need support. So that's what the dynamic part of Recovery Dynamics is all about. So what is PGX testing? We're talking about trying to better prescribe medications for you. Everybody's body is different, and the PGX testing allows us to figure out what medications are best to prescribe for you, what your body metabolizes best. If you've ever been prescribed a medication you felt like, oh, this is really a problem for me, the PGX testing allows us to eliminate and reduce the guessing game that comes into prescribing medication. We don't want to wait 3 and 4 weeks to try to figure out whether the medication works best for you. We want to be more targeted and more effective in our prescribing. This allows us to, again, take out the guesswork in prescribing medication and give you medications that we know by this testing that are going to work better for your body. So EMBP, you can think about that as a technology that helps to put your brain back in its optimal rhythm. If you've ever heard about an arrhythmia of your heart, let's say your heart has a very specific rhythm, but it's not beating properly. And what EMBP does, it helps to put your brain back into its best optimal rhythm. A lot of times what we find is that people are using drugs and alcohol to help themselves feel better. They're correcting for the rhythm of their brain. Something feels off all the time, so they use drugs and alcohol. So what we've been able to discover with this technology is there's a specific rhythm that we can use through a magnet to help suggest to the brain getting it back to the rhythm that's most natural. And it can help ease the experience of your detox. And there's no other place that does this. That's what makes this so exciting, that we can bring in technology to set the rhythm of your brain to make you feel, as the user of that brain, much more comfortable in your own body. So what is TMS? It's transcranial magnetic stimulation. It's an FDA-approved non-invasive treatment that uses a magnetic impulse, a coil that's placed over your dorsolateral prefrontal cortex. This is the area in the brain that we understand that controls mood. People that qualify typically have failed on medications. Medications are not working. So we can offer this in our treatment environment. No other place does that. Again, that's what makes recovery dynamics so exciting. So aftercare, we know that your life doesn't end after you leave the treatment center. In fact, it's beginning. And we want it to begin with new skills and new ways of looking at things and new ways of living, new ways of behaving. So we offer partial hospitalization programs and what's called IOP, intensive outpatient program. These are very similar in that you still have access to individual therapists. You can still go to groups, but we know that lifes and it adds stress to you. So you still need support. So it's a way that you can reintegrate back into living your life, but living it in a better way and still having access to support. Those transitions are absolutely critical to your livelihood. So we support that, we offer that, and it's all integrated into your treatment. So it's not like you have to go somewhere else. You can stay within our system and we will come alongside you to help you readapt and deal with the stressors of life from day to day and help to remind you about those skills that you've learned through the Recovery Dynamics programs.